Have you ever found yourself wondering about the complex mysteries of the male body, particularly as it changes with age? One such phenomenon that tends to surprise and sometimes alarm men is the concept of a dry orgasm. It's a situation where a man reaches the peak of sexual pleasure, yet there is little to no ejaculation. While this might sound strange or concerning, understanding the science behind it can replace worry with clarity and confidence. At its core, a dry orgasm, or retrograde ejaculation, is when semen doesn't exit the body as expected. Instead, it flows backward into the bladder. This is not just a random occurrence, but a specific physiological process involving the muscles and nerves responsible for ejaculation. It's more common than you might think, especially among older men or those undergoing certain medical treatments. Sexual health is a vital aspect of overall well-being. When something as significant as ejaculation changes, it's natural to feel unsettled or even embarrassed. However, understanding the underlying causes and potential impacts of dry orgasm can help you regain control and even view it as an opportunity to deepen intimacy and explore new aspects of sexual pleasure. Let's demystify this phenomenon by exploring what happens during ejaculation. Normally, during orgasm, the body triggers a sequence of muscular contractions that propel semen through the urethra and out of the penis. In retrograde ejaculation, however, these contractions are interrupted. The bladder's internal sphincter, which usually closes tightly to prevent semen from entering the bladder, may fail to do so. This results in the semen taking a detour into the bladder instead of being expelled. If you haven't joined our community yet, I invite you to hit the subscribe button and turn on the notification bell so you're always up to date with our latest content. I'd love to hear your thoughts on today's discussion. If you find this content helpful, drop a 1 in the comments below. If it doesn't quite resonate with you, leave a 0. Your feedback is invaluable. It helps me craft videos that better suit your interests and needs. Now, let's dive right in. Dry orgasm, medically known as retrograde ejaculation, is a phenomenon where semen takes an unexpected journey, traveling backward into the bladder instead of exiting through the urethra. While this might seem perplexing at first, understanding the intricate mechanisms behind it can demystify the experience and help men feel more informed and empowered. In a typical ejaculation process, the body relies on a well-coordinated series of muscular contractions to ensure semen is propelled forward. At the center of this operation lies the internal sphincter of the bladder, a ring of muscles that acts as a gatekeeper. During ejaculation, this sphincter closes tightly, preventing semen from flowing into the bladder while guiding it toward the urethra. However, in the case of retrograde ejaculation, this gatekeeper falters, allowing semen to bypass its usual route and mix with urine inside the bladder. The root cause of this malfunction often lies in disruptions to the autonomic nervous system, which governs involuntary bodily functions like heart rate and digestion. Specifically, the sympathetic nervous system, responsible for controlling the contraction of the bladder's internal sphincter during ejaculation, may become impaired. This disruption can occur due to various factors, including nerve damage, certain medical conditions, or side effects from medication. One of the most common culprits behind retrograde ejaculation is the use of medications that interfere with nerve signals. Drugs prescribed to manage conditions like high blood pressure, depression, and anxiety often have a relaxing effect on the smooth muscles of the bladder. While this helps in managing these health issues, it can inadvertently prevent the bladder sphincter from contracting properly during ejaculation. Similarly, medications used to treat prostate conditions, such as alpha blockers, can weaken the muscles involved in ejaculation, further contributing to the phenomenon. Surgical procedures, particularly those involving the prostate or pelvic region, can also disrupt the delicate balance required for ejaculation. Surgeries like transurethral resection of the prostate, TURP, commonly performed to address benign prostatic hyperplasia, BPH, can damage the nerves and muscles responsible for proper ejaculation mechanics. While these interventions often improve urinary function, they may result in the unintended consequence of retrograde ejaculation. Endocrine factors, such as a decline in testosterone levels with age, can add another layer of complexity. Testosterone, the primary male hormone, plays a crucial role in regulating sexual function and maintaining the strength of the muscles involved in ejaculation. As testosterone levels naturally diminish over time, the muscles of the bladder sphincter may weaken, increasing the likelihood of retrograde ejaculation. Despite the clinical explanations, it's important to note that retrograde ejaculation is not harmful to overall health. Semen mixed with urine inside the bladder is later excreted during urination, posing no risk to the urinary system. However, it can impact fertility, as the absence of semen during intercourse prevents the transfer of sperm to the partner. For men trying to conceive, this can present a challenge that may require medical assistance, such as sperm retrieval techniques. Understanding the science behind dry orgasms sheds light on how and why this condition occurs, but it also opens up opportunities to explore how these changes can be managed or adapted to. While retrograde ejaculation may initially seem daunting, knowledge provides a pathway to acceptance and empowerment. Now that we've explored the scientific mechanisms behind dry orgasms, it's time to delve into the various causes in greater depth. From surgical interventions to hormonal shifts, the contributing factors are as diverse as the experiences of those affected. Let's examine these causes more closely in the next section and uncover how they shaped this intriguing phenomenon. Understanding the detailed causes of retrograde ejaculation or dry orgasm requires looking closely at the factors influencing the delicate processes of ejaculation. These causes can stem from physiological changes, medical interventions, or hormonal fluctuations, each playing a distinct role in this phenomenon. Retrograde ejaculation is primarily characterized by the misdirection of semen during orgasm. Instead of being expelled through the urethra, semen mixes with urine in the bladder. This occurs when the bladder's internal sphincter, responsible for directing semen outward, fails to close properly during ejaculation. The mechanism is straightforward yet intricate. The internal sphincter should act as a gate, closing to block the bladder and opening to allow semen to exit the body. When this gate malfunctions, semen takes the path of least resistance, backward into the bladder. While retrograde ejaculation does not pose a threat to overall health, its implications for fertility can be significant. The absence of visible semen means that sperm is no longer transferred during intercourse, making natural conception difficult. For couples trying to conceive, this condition can introduce emotional and practical challenges, requiring medical interventions like sperm retrieval or assisted reproductive technologies. Medications often play a significant role in causing retrograde ejaculation. Drugs prescribed to manage chronic conditions, such as high blood pressure, diabetes, and depression, can interfere with the normal functioning of the nerves and muscles involved in ejaculation. For example, alpha blockers, commonly used to treat hypertension or benign prostatic hyperplasia, BPH, relax the smooth muscles of the bladder and prostate. While effective for these conditions, this relaxation can prevent the internal sphincter from closing tightly, leading to retrograde ejaculation. Diabetes, a condition known to damage nerves over time, can also disrupt the autonomic nervous system responsible for ejaculation. Neuropathy, or nerve damage caused by prolonged high blood sugar levels, weakens the signals that control the bladder sphincter and surrounding muscles. Similarly, certain antidepressants, particularly those in the selective serotonin reuptake inhibitor SSRI category, can suppress the nerve activity required for ejaculation, leading to retrograde flow. Surgical procedures, especially those involving the prostate or pelvic area, are another common cause. Surgeries like transurethral resection of the prostate, TURP, or radical prostatectomy, often performed to address prostate cancer or an enlarged prostate, can inadvertently damage the nerves and muscles essential for ejaculation. These procedures are designed to improve urinary function or remove malignant tissue, but their proximity to the intricate nerve networks in the pelvis makes side effects like retrograde ejaculation a frequent consequence. Hormonal changes, particularly a decline in testosterone levels, further contribute to this condition. Testosterone plays a pivotal role in maintaining the strength and functionality of the muscles involved in ejaculation. As men age, testosterone levels naturally decrease, which can weaken the internal sphincter and the muscles driving the ejaculatory process. This decline not only affects the physical mechanics of ejaculation, but also impacts overall sexual health, including libido and erection quality. Beyond these specific medical and physiological factors, certain lifestyle choices can exacerbate the likelihood of retrograde ejaculation. Poorly managed chronic conditions like diabetes, prolonged stress, or inconsistent use of prescribed medications can worsen the underlying causes. Additionally, excessive alcohol consumption or smoking, both known to negatively affect nerve health and hormone levels, can increase the risk of developing this condition. Despite its varied causes, retrograde ejaculation is a manageable condition. For men not concerned with fertility, the focus often shifts toward understanding and accepting the changes in their bodies. However, for those seeking to address its impact, targeted treatments, ranging from medication adjustments to specialized therapies, can offer solutions. Now that we've examined the detailed causes of retrograde ejaculation, it's time to explore the emotional and relational impacts of this condition. How does it affect self-esteem, intimacy, and communication with a partner? In the next section, we'll delve into the personal and interpersonal dimensions of dry orgasms, uncovering ways to maintain and strengthen connections amidst these changes. The journey of understanding retrograde ejaculation extends far beyond its physiological mechanics. For many men, the condition has profound emotional and relational implications, influencing their sense of self and their interactions with intimate partners. Navigating these effects with awareness and empathy can transform challenges into opportunities for growth and connection. Experiencing retrograde ejaculation often brings a mix of emotions. For many men, the absence of visible ejaculation during orgasm can feel like a loss of control over their body. This change can lead to feelings of inadequacy, a diminished sense of masculinity, or even embarrassment. Over time, such emotions may erode self-confidence, leaving a man questioning his sexual vitality and desirability. These insecurities, if left unaddressed, can spill over into other areas of life, creating a ripple effect on overall well-being. Increased stress and anxiety often accompany these feelings. For some, the worry extends beyond their physical experience to concerns about how their partner perceives them. Will they notice? Will they feel unsatisfied? These questions can spiral into self-doubt, making it harder to enjoy intimacy without overthinking. In more severe cases, the emotional toll of retrograde ejaculation can lead to depression, particularly if a man internalizes the condition as a personal failing rather than a natural part of aging or a side effect of medical treatment. The impact doesn't stop at the individual. Relationships can also feel the strain of retrograde ejaculation, particularly when communication is lacking. Many men hesitate to discuss the condition with their partners, fearing judgment or rejection. This silence, however, often creates a void that can be filled with misunderstandings. A partner might misinterpret the absence of ejaculation as a lack of interest or arousal, leading to feelings of insecurity or confusion on their part. Bridging this gap requires open and honest communication. Acknowledging the condition and sharing concerns with a partner can foster understanding and intimacy. Partners who are informed about retrograde ejaculation are more likely to respond with compassion rather than confusion. This dialogue also creates an opportunity to reinforce that physical changes do not diminish love, attraction, or commitment. Together, couples can explore how to maintain a satisfying and fulfilling sexual relationship despite the changes. In some cases, retrograde ejaculation may serve as a catalyst for redefining intimacy. Many couples discover that the absence of visible ejaculation shifts their focus away from performance and toward connection. They begin to explore new ways of expressing affection and building closeness that go beyond physical acts. Emotional intimacy, sharing fears, dreams, and vulnerabilities, can deepen as couples work together to navigate the challenges of retrograde ejaculation. Physical intimacy can also take on new dimensions. Instead of viewing ejaculation as the ultimate endpoint of sexual activity, couples may explore alternative ways to experience pleasure and satisfaction. This might include focusing on prolonged foreplay, experimenting with different forms of touch, or simply finding joy in being present with one another. Such shifts can make sex more exploratory and less goal-oriented, which in turn enhances the overall experience. For some men, the process of coming to terms with retrograde ejaculation includes reframing their perspective on masculinity and sexual identity. Recognizing that these are not solely defined by physical performance, but also by emotional presence and partnership, can be liberating. By embracing the changes in their body with acceptance and grace, men can reclaim confidence and redefine what it means to be a fulfilling partner. It's also worth noting that seeking professional support, whether from a therapist, counselor, or sexual health expert, can be invaluable. These professionals provide a safe space to discuss feelings and offer strategies for coping with the emotional and relational aspects of retrograde ejaculation. For couples, counseling can help improve communication, strengthen emotional bonds, and explore new paths to intimacy. Retrograde ejaculation, like any other significant change, is an opportunity to grow. While it may initially feel like a limitation, it has the potential to bring couples closer together by encouraging them to prioritize connection and mutual support. By shifting the focus from what's lost to what can be gained, individuals and their partners can create a richer, more fulfilling relationship. With a better understanding of the emotional and relational dimensions of retrograde ejaculation, we can now turn our attention to practical solutions. What steps can individuals take to manage this condition and maintain a healthy sexual life? In the next section, we'll explore expert recommendations, lifestyle adjustments, and actionable strategies to address the challenges of retrograde ejaculation. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Navigating retrograde ejaculation is not just about understanding its causes and effects, it's about taking actionable steps to manage the condition and maintain a fulfilling sexual and emotional life. With the right medical advice, lifestyle adjustments, and communication strategies, individuals and their partners can adapt to these changes while preserving intimacy and well-being. Seeking medical advice is the first and most critical step for men experiencing retrograde ejaculation. Consulting a specialist, such as a urologist or endocrinologist, provides clarity and tailored guidance. During a medical evaluation, your doctor may conduct tests to rule out underlying conditions like diabetes or nerve damage, as these often contribute to the issue. They may also ask about medications you're taking, as certain drugs are known to interfere with the nerves and muscles involved in ejaculation. For men aiming to address fertility concerns or restore ejaculation, hormone therapy may be an option. Testosterone replacement therapy, for instance, can help counteract hormonal imbalances that weaken the bladder's sphincter muscles. Another promising avenue is pelvic floor exercises, commonly referred to as Kegel exercises. These exercises strengthen the muscles supporting the bladder, prostate, and pelvic organs, improving overall control during ejaculation. Guided by a trained physical therapist, these techniques can significantly enhance muscle function and reduce the effects of retrograde ejaculation. In addition to medical interventions, making lifestyle adjustments can play a pivotal role in managing the condition. A healthy diet rich in lean proteins, whole grains, and vegetables not only supports overall health but also promotes better hormonal balance. Foods high in zinc and magnesium, for example, can contribute to improved testosterone levels and reproductive health. Avoiding excessive alcohol and reducing tobacco consumption can also mitigate nerve damage and hormonal imbalances that exacerbate retrograde ejaculation. Stress management is another cornerstone of addressing this condition. Chronic stress can worsen nerve dysfunction and lower testosterone levels, amplifying the underlying causes of retrograde ejaculation. Incorporating relaxation techniques like mindfulness, meditation, deep breathing, or yoga into your routine can have a transformative effect on your physical and emotional well-being. Regular exercise, whether it's strength training or cardiovascular activities, also promotes endorphin release, enhances circulation, and strengthens pelvic muscles, contributing to overall sexual health. While medical treatments and lifestyle changes address the physical aspects of retrograde ejaculation, open communication is essential for tackling its emotional and relational dimensions. Honest conversations with your partner about what you're experiencing can alleviate misunderstandings and foster deeper intimacy. Many men hesitate to discuss retrograde ejaculation out of embarrassment or fear of being judged, but these concerns often diminish once the subject is broached with empathy and openness. Creating a space for dialogue can lead to mutual understanding and collaboration. Partners who feel included in the discussion are more likely to respond with compassion and support. Together, couples can explore ways to maintain intimacy, shifting the focus from physical performance to emotional connection. This might involve experimenting with new approaches to pleasure, such as extended foreplay, sensual touch, or simply prioritizing moments of closeness without the pressure of traditional goals. Professional counseling or therapy can further facilitate these discussions. A therapist specializing in sexual health or couples counseling can provide tools for navigating the changes retrograde ejaculation brings to a relationship. These sessions can also help identify and address underlying emotional barriers, whether they stem from self-esteem issues, past experiences, or the dynamics of the partnership. For men seeking to conceive, medical professionals may suggest sperm retrieval techniques. These methods, combined with assisted reproductive technologies like in vitro fertilization, IVF, can help overcome the fertility challenges posed by retrograde ejaculation. While this route requires commitment and collaboration, it underscores the importance of focusing on solutions rather than dwelling on limitations. Addressing retrograde ejaculation is not about returning to an old normal, but rather embracing a new reality with confidence and adaptability. The condition, while unexpected, is an opportunity to grow, both individually and as a couple. By combining medical guidance, intentional lifestyle changes, and proactive communication, men can navigate this journey with resilience and optimism. Having explored the medical and practical approaches to managing retrograde ejaculation, it's essential to turn our attention to the mental and emotional resilience required to thrive. In the next section, we'll delve into psychological support, stress reduction, and the empowerment that comes from embracing change with confidence. Managing retrograde ejaculation isn't just about addressing its physical and relational impacts, it also involves nurturing emotional and mental well-being. The psychological toll of this condition can be significant, but with the right strategies, men can cultivate resilience, boost confidence, and maintain a positive outlook on their sexual and overall health. Stress often acts as both a cause and consequence of retrograde ejaculation. For men grappling with this condition, the sense of losing control over an intimate aspect of their lives can amplify stress, creating a feedback loop that exacerbates the problem. Addressing this stress is critical, as prolonged tension can further disrupt nerve function, lower testosterone levels, and diminish sexual satisfaction. One of the most effective ways to combat stress is by adopting mindfulness practices. Techniques like meditation and deep breathing help ground the mind and body, reducing the physiological responses associated with anxiety. A few minutes of focused breathing daily can lower cortisol levels, enhance relaxation, and create mental clarity, allowing men to approach challenges with a calmer, more constructive mindset. Yoga and Tai Chi also combine physical movement with mental focus, offering a holistic approach to stress relief that promotes both strength and serenity. Exercise remains a cornerstone of emotional and physical health. Regular physical activity releases endorphins, nature's mood enhancers, that counteract feelings of frustration and anxiety. Strength training and cardiovascular activities not only improve overall fitness, but also boost self-esteem and body image, which can take a hit when dealing with retrograde ejaculation. Setting achievable fitness goals and celebrating progress can help rebuild confidence, reinforcing a sense of agency and accomplishment. Psychotherapy or counseling provides a deeper level of support for men navigating the emotional complexities of retrograde ejaculation. A licensed therapist specializing in sexual health or cognitive behavioral therapy (CBT) can help identify negative thought patterns and replace them with empowering perspectives. For example, rather than viewing retrograde ejaculation as a loss, therapy can reframe it as an opportunity to explore new dimensions of intimacy and personal growth. Group therapy or support groups also offer significant benefits. Sharing experiences with others who face similar challenges fosters a sense of community and reduces feelings of isolation. In such settings, men often find reassurance in knowing they are not alone and can draw strength from the collective wisdom of the group. Partners can also participate, gaining insights into the emotional aspects of the condition and learning how to provide support. Building confidence is a gradual but essential process. Men may initially feel self-conscious about discussing retrograde ejaculation, but opening up in safe and supportive environments helps diminish the stigma. Practicing positive self-talk and focusing on one's strengths outside of sexual performance can restore a balanced self-image. Remember, masculinity and self-worth are not defined solely by physical capabilities, but also by qualities like emotional presence, resilience, and the ability to nurture meaningful connections. Embracing a growth mindset is another powerful tool. This involves viewing retrograde ejaculation not as a fixed limitation, but as an opportunity for exploration and adaptation. Men who adopt this mindset often discover new ways to experience and share pleasure, deepening their intimacy with partners in the process. Celebrating small victories, whether they involve improving communication or finding joy in new forms of connection, reinforces progress and builds momentum for further growth. Developing a strong support system is equally important. This includes trusted friends, family members, or professionals who can provide encouragement and perspective. Leaning on these relationships during challenging moments reminds men that they don't have to face these experiences alone. The simple act of sharing concerns and receiving empathy can lighten the emotional burden and pave the way for constructive solutions. As men work to improve their mental health, they often find that these efforts positively impact other areas of life. A calmer mind and renewed confidence enhance not only sexual experiences but also professional performance, relationships, and overall life satisfaction. Retrograde ejaculation becomes less of a barrier and more of a stepping stone to a fuller, richer existence. Having explored ways to nurture emotional resilience and cultivate confidence, it's time to bring the journey full circle. In the final section, we'll focus on embracing change and redefining intimacy, discovering how retrograde ejaculation can lead to deeper connections and a more fulfilling perspective on life and relationships. Life is full of transitions, and the changes that come with retrograde ejaculation are no exception. Embracing these shifts with openness and resilience can transform what may initially seem like a limitation into an opportunity for growth, deeper connection, and a renewed appreciation for life's natural rhythms. One of the first steps in adapting to retrograde ejaculation is accepting that aging is a natural process. Just as our bodies change in appearance and strength, so too do our internal systems evolve over time. These changes are not failures or signs of inadequacy, but rather markers of a life well lived. By reframing aging as a journey of discovery rather than decline, men can find empowerment and meaning in the new chapters of their lives. Acceptance doesn't mean complacency. It's about acknowledging what cannot be changed, while focusing on what can be enriched or improved. Retrograde ejaculation offers an opportunity to explore new dimensions of intimacy that extend beyond physical mechanics. For many couples, this shift can lead to a stronger bond, where emotional connection and mutual understanding take center stage. By valuing moments of closeness and communication, relationships can flourish even in the face of physical changes. Redefining intimacy is a crucial part of this journey. While traditional sexual expressions might evolve, this creates room to explore alternative forms of connection. Prolonged foreplay, sensual touch, and mindful presence can bring couples closer, allowing them to rediscover each other in ways that go beyond the act of intercourse. By focusing on the emotional and psychological aspects of intimacy, couples can create experiences that are just as fulfilling, if not more so, than those of their younger years. Adopting a growth mindset is essential for navigating these changes. Rather than dwelling on what's been lost, men who embrace retrograde ejaculation as an opportunity to grow often find unexpected benefits. This mindset encourages curiosity, exploration, and a willingness to adapt. For instance, Men may discover newfound confidence in their ability to communicate openly with their partners, strengthening their relationship in ways that extend far beyond the bedroom. Building resilience also involves celebrating small victories. Whether it's mastering new techniques for intimacy, improving communication with a partner, or simply feeling more confident in one's own skin, each step forward reinforces a sense of accomplishment. These milestones serve as reminders that growth is possible at any stage of life. Sharing these experiences with others can also provide a sense of solidarity and support. Talking openly with friends, joining a support group, or seeking professional guidance can help men process their emotions and gain new perspectives. When shared, challenges often feel lighter, and the insights gained from others' experiences can be invaluable in finding solutions or approaches that work. It's also important to recognize that retrograde ejaculation doesn't diminish one's worth or identity. Masculinity and self-esteem are multifaceted and should not be confined to physical performance. Instead, qualities such as emotional presence, kindness, and resilience define a man's character and his ability to nurture meaningful relationships. As men and their partners navigate the changes brought about by retrograde ejaculation, they often find that these experiences strengthen their overall perspective on life. The challenges of aging, while undeniable, become opportunities to appreciate the present, deepen connections, and approach the future with hope and curiosity. Life, after all, is not defined by the absence of difficulties, but by how we rise to meet them. Ultimately, retrograde ejaculation can serve as a powerful reminder that sexuality is not a static concept. It evolves alongside us, shaped by the complexities of our bodies, minds, and relationships. Embracing this evolution can lead to a more holistic and fulfilling understanding of intimacy, one that celebrates connection in all its forms. Retrograde ejaculation, like many aspects of aging, is an invitation to grow physically, emotionally, and relationally. By embracing change, exploring new possibilities, and focusing on what truly matters, men and their partners can find not just adaptation but transformation, discovering richer and more meaningful connections along the way. If you found this video helpful, don't forget to give it a thumbs up and share it with someone who might benefit from this topic. Have any thoughts or personal experiences to share? Drop them in the comments below. I'd love to hear from you. And if you haven't already, click the subscribe button and ring the notification bell to join our community for more empowering content. Thank you for watching, and until next time, embrace the journey with confidence.